always the easiest, Dr. Nila. If you can just say and spell your first and last name for me.
Sure. It is Dr. Nila Devanath, and it is Nila, and the last name is Devanath.
All right, thank you so much, Dr. Nila. So before I get into all the political questions about why you're deciding to run for Virginia's 2nd Congressional District, tell me a little bit about yourself, your upbringing, where you're from. Are you from Virginia? I know, like you said, you are a doctor, so tell me a little bit about your medical professions as well before we get into politics.
Yeah, of course. Well, so I am running for the 2nd Congressional District, as you know, and I actually grew up right here. So I am a Hampton Roads native for all intents and purposes. Was born in Pittsburgh, but came here when I was 6 months old. So I've been here for 37 and a half years, almost 38 years now. My parents actually immigrated here from Bangladesh about 40 years ago, and they were living in the Hampton Roads area and went up north very briefly for about a year. I was born there, and then they came back. So we've been here for about 4 decades now. There is about, I think, almost 35 of my family members who live in the Chesapeake and Suffolk area. And I went to high school here in Suffolk. I went to Nansemond Suffolk Academy. I went to Chittum Elementary in Chesapeake. And after that, I took a little brief exodus up north. So I went to the University of Pittsburgh for college. I went to Harvard for law school, became an attorney, and I went to University of Pittsburgh for School of Medicine, became a doctor, and then I finished up my medical training at Yale. And then I came back here because my community needed me during COVID. So I knew that there was a lot of opportunities for me to stay up north with all of the work that I did kind of on the federal level as well. I worked for the DOJ, I worked for the CDC, and I helped shape some policy nationally as well. But during COVID, our rural communities were hit very hard, and I needed to come back home. I know Suffolk, that's where I grew up for 18 years. And the community there, a lot of people didn't get vaccinated, and unfortunately a lot of people passed away. And COVID really hit the rural communities, I think, the hardest because of these messages coming down from DC that were telling them, hey, maybe you shouldn't get the vaccine or you should be scared. And unfortunately that led to a lot of destruction. So I stayed here back in Hampton Roads. I became a community hospital doctor. Previously used to work for the VA, but now work in the community. And I'm acute care. So what that means is I work in ICUs, emergency rooms, and the hospital ward. So I kind of see the sickest of the sick, right? People who are, sometimes even on death's door. And to me, I know we didn't even go into this, but that's actually the reason that I started running for Congress. So it was my patients. Even though I work in the community, pretty much every other patient that I see is a veteran or active duty, and they're coming in with diseases that are preventable. My most common patient is a veteran patient who has diabetes, who maybe tried to go to the VA, for a long time, didn't get an appointment for 6 months or 9 months, and they might have a foot infection. And then that foot infection spread from, maybe the toe to the foot to the leg. And unfortunately, I am calling a surgeon to literally, this happened just a few months ago, chop off a leg. And I wish that I could tell you that that just is a rare occurrence, but it happens almost every time I'm in the hospital. So every month we are doing amputations. And, when we talk about chopping off limbs, right, this reminds me of wartime medicine. And why are we practicing wartime medicine in this time that's supposed to be a time of peace and prosperity in the country, so they say? And it's not, And when Jen Kiggans voted for the big ugly bill, I call it the big ugly bill because really it's had tremendous detrimental effects on our population. I couldn't understand the reasoning behind that. She herself is a veteran. She herself is a healthcare provider, nurse practitioner even, and she knows what patients are going through. You know, a lot of people say, okay, there's folks in Congress who have no idea, never taken care of a patient in their lives, but she has. So for her to make that vote, it really showed me who she was. And for me, living in this community, being here with my family my whole life, with my patients, I really couldn't let that happen. So I started running because Medicaid is so important to this community. Not only does our community rely on it, but particularly our veterans. In District 2 alone, actually 50%, almost 50% of our veterans switch over to Medicaid, from the VA system, from TRICARE. Why do they do that? It's because it sometimes gives them more opportunities in the community to get care, specialists, even primary care providers, because our VA system here in District 2 and throughout Hampton Roads is stretched entirely too thin. You might have seen they put up a new center in Chesapeake, but it's understaffed. So it's a big shiny building with not enough people in it to serve the need. That doesn't make sense to me either, you know. But what Medicaid does is it kind of acts as this fail-safe. It's like, hey, there's something else that will provide you health care. Now that's being taken away and cut for our veterans and our families, our working families. And it's just not right, because when people go without health care and they fall through the cracks, that's when I see them in the emergency room, right? So I intimately know the struggles that our families here in Hampton Roads and District 2 are going through, and it's just not right. We need to restore Medicaid. We need to make sure that the ACA subsidies are restored as well, because even though those were COVID-era subsidies, our economy has changed, right? We rely on those subsidies for healthcare. Now people, their insurance has gone up by what, $1,000, sometimes $2,000? That's rent, that's mortgage, right? We can't keep adding these things on top and not expect our community to break. We are in an affordability crisis, right? Gas prices are rising. We've all seen that. We've all been affected by that. And it's because also we're in this war, right? I don't agree with the decisions that have been made regarding the war with this administration. We are not 100% clear why we're sending our service members, our active duty, into this war zone to potentially be killed. We already know that several service members already lost their lives in this conflict. And if we're not 100% clear, why would you risk sending your family members, your friends, your neighbors overseas to die? I don't see that. I don't see why we're doing that, because it's not 100% clear. In addition to that, I stand out amongst some of the other primary candidates, because one of my big pushes, besides healthcare, which I think we should restore those, but also fight for universal healthcare. But the other pillar that we stand on is fighting corruption in Congress. So I don't take any corporate money. I don't take any money from AIPAC. I believe in term limits. I believe in a ban on stock trading for individuals, members of Congress and their families. And the reason for that is because, let's go one by one. AIPAC, right? They are buying politicians on both sides of the aisle. Those politicians are making decisions to keep us in these unending wars in the Middle East. Not only that, but we're not even looking at the humanitarian crisis that the military of Israel is perpetuating on the Palestinian people, right? It's a genocide. There have been tens of thousands of children who have been killed, women and children, and I think we have to take a pause and acknowledge what's happening. My own family survived genocide in order to come to this country so that I could be born here, right? That they could become part of the community, right? And serve our community. My mom, she's worked for TRICARE for 30 years, serving our veterans, serving our active duty. And we're so proud to be here, but it's because they survived that genocide, right? So I know what people on the other side are going through. And we have to name it, right? If you're not willing to talk about it, if you can't name evil, you can't fight it, right? That's the reason I don't take any APAC money. I also, in the same vein, do not take any corporate money. And I do think that billionaires and corporations should pay their fair share. Why is that? Corporations are also destroying our society in a different way. They're buying up housing stock. Think about the private equity firms. I particularly see this living in North Suffolk. I mean, you can see all of these new fancy condos being built. Mm-hmm. Land is being bought up, but it's all private equity and big, big corporations, you know? And what that does is it prices people out, right? They don't have the opportunity to have affordable housing. You know, we see the data centers, right? Virginia has the highest number of data centers in the country as a state. 80% of internet traffic goes through Virginia, so we're like basically the internet, okay? And data centers are pulling on our resources, right? They're taking up farmland that could be used for food. They are pulling on our electrical grid. They're making our utility costs go up, and they have a huge cost on the environment too, right? Anybody who lives near a data center that's already been built, if you look at their water quality, I mean, you've seen the videos where people turn on the faucet and it's brown. It's terrible. That's terrible. And it's like, there was a data center proposal, out in Suffolk, out in Chesapeake, and Virginia Beach, right? We need to have a moratorium on that, and we need to pause. But big corporations are also behind that. And when we talk about corporations in healthcare, right? Think about the insurance industry. Think about the pharmaceutical companies. It's kind of like the right hand is paying the left hand, right? It's just an internal loop. That's where the money is going. But who pays the price? We pay the price. And that's not okay because we are struggling, right? People are working 2 jobs, 3 jobs, trying to take care of their kids, trying to pay these bills. And, their vote is being suppressed, right? I even looked at just early voting here. Why is early voting Monday through Friday, 9 to 5? And Tuesday is election day, it's a work day. So if you are a working person, 1 job, 2 jobs, 3 jobs, you don't really have an opportunity to vote, except for 4 weekend days. Out of 45 days of early voting, only 4 were on the weekend. That's crazy to me. That is crazy to me because that means, your vote is being suppressed if you have to survive and work during those hours. And sometimes people are even too busy to make a plan to go vote. So I wanted to encourage everybody to go vote because August 4th is literally around the corner. It is next week. Please, 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 make a plan to go vote. There is 1 weekend day left, I believe, which is August 1st. So that's going to be this coming Saturday. Mm-hmm. And the strange part is August 2nd, Sunday, and Monday, August 3rd, you can't vote. Isn't that weird? Why would they do that, right? So we have to think about voter suppression on a systemic level, but we also have to think about it in a historic level, right? We're in a very historic time right now. The Voting Rights Act has been suppressed, been gutted. Majority minority districts around the country are being redistricted, right? The voice of minority people, Black and brown folks, is really being attacked right now. And when I looked into the history of this district, can you believe that in 237 years, there's never been a person of color? And this district is about 50% people of color. And I thought, I didn't intend on running to break a historic barrier, but I'm so glad that I ran. And I am so glad that we are going all the way to the end with this because we have to stand up and we have to give people an option and a voice going forward, right? I want to be proud to say that, hey, if there's other people coming after me, that, hey, there was somebody who ran, there's somebody who stuck it out till the very end. So I'm just really proud to say that too. I know that was rambling a lot, but
no,
it's like,
thank you so much for all of that. I mean, that really nailed.
I was just going like,
most of the questions I had, especially just about what your priorities are,
Mm-hmm.
and you even touched upon how your experiences from your medical career you believe will best prepare you to represent Virginia's 2nd Congressional District. We talked about healthcare. If we can speak to this a little bit more, we know that this district is one of the most competitive congressional districts, quite frankly, in the country. I think everyone's eyes, even ahead of Tuesday, after
it is a
Tuesday,
marquee
it's
race.
going to be, it's a marquee race. And, why do you believe, just to reiterate again that for me, that you're the strongest Democrat to take on Congresswoman Jim Kiggans, the current Congresswoman and incumbent, in November if you were to win that primary on Tuesday? What do you believe your campaign offers that others necessarily do not?
Yeah. Our campaign is completely 100% people-powered community support, right? We don't have the big corporate millions or anything like that, or APAC or anything like that. All of our funding has come from the community. We have a volunteer, there's actually several hundred volunteers that have signed up, right? And we have a group of very active volunteers who are getting out into the community and are fighting. But beyond that, I think I'm the person that really represents, out of their primary candidates, just people who live and work here, right? I'm actually the only working person in this primary. I'm not a retired multimillionaire. I do have to work. In fact, I have shifts coming up in the hospital this month. I'm a new mom. I am representing a progressive voice that is really anti-corruption and anti-corporate money and anti-APAC. And I think that's really important on both sides of the aisle, because there are folks in the primary who in their past have taken corporate money and APAC, and also on the Republican side as well. But I think people are really fed up with that. They want somebody who speaks truth to power, and that's me.
Thank you so much, Dr. Nila. We spoke a little bit about, I know you said your mother has worked in TRICARE. This TRICARE is something that the past few months that I've been speaking about with our current Congresswoman Jim Kiggans, and I wanted to bring this up to you as someone so heavily involved in the medical industry, as far as TRICARE, as far as the VA system, particularly when it comes to healthcare, housing, and employment. And I just recently reported on the passing through the House of the NDAA.
Yes.
And one of the provisions in the NDAA is eliminating gender-affirming care for our military and service members, which is we've been seeing a lot of provisions that are particularly impacting our queer community, our transgender community. And I know we spoke a little bit about the VA system and its operations and the lack of staffing. What, in a culmination of all of this, what do you believe needs to be done, or how will you address these concerns in Congress? Not only are we the home of the data center hub, we're also the hub of one of the most strongest military naval bases,
the largest naval base in the world. Yep. Well, I think those are really great questions, and kind of to break it down separately. So first of all, with the VA and TRICARE, we need more funding for our veterans, right? They served our country with their lives, and they deserve the best care possible. When you actually get care at the VA and TRICARE, it's excellent, right? Those doctors and nurses are working tirelessly around the clock. The issue is access, and we need to provide more access with more funding. Now, let's talk about gender-affirming care. I don't care what you are going through and what the negative naysayers say. If you are a veteran, if you served our country and that is part of your health care, you deserve your health care. So all of these provisions that are being put out that are trying to reverse that and take it away from people, gender affirming care, reproductive rights, other types of healthcare, all of that needs to stop. People need their care, period. And then I think I forgot the last part of it, Christian. We were talking about gender affirming care, and then I think you had another.
I think you kind of.
Oh, the NDAA.
Yeah.
Well,
the
let me
NDAA.
talk about the NDAA, because that was such a big bill as well, right? And there are many parts to it. One part in particular, which you didn't mention, but I do want to kind of talk about since we're on that subject, is the provision that would combine the U.S. military with Israel's military. The House passed it. The Senate blocked it. Thank goodness that they blocked it, because the last I checked, our military should fight for us, right? We do not need our military to be entwined or entrapped in any other country's military, right? That puts American citizens at risk, because it's whose benefit are we doing things for, right? I don't think that it was right that that provision was there. And by the way, you can see by the voting record in the House, it wasn't just Republicans, right? It was Democrats too. And I think what's happening now is not left versus right. There is an anti-corporate and anti-APAC wing of both parties that is really rising up. And those are the community-powered and people-powered groups. That is what we are fighting for in this campaign. You know, if you like the corporations controlling you, if you like AIPAC buying your politicians, if you like staying in the war, hey, more power to you, you know, if you want to vote that way. But if you're looking for a candidate who stands against those things and is willing to fight for you and make sure that none of those biases get in the way, then I'm your candidate.
Thank you, Dr. Nila. I have about 2 more questions for you. Tell me a little bit about how your campaign trail has been over the past few months.
Yes, oh my goodness.
I know you're, like you said, people-powered, community-centered, community-focused. How has your campaign been? How confident are you in your campaign efforts? And throughout your conversations with constituents, not only in Virginia's 2nd Congressional District, but it seems as if you have a voice in the community and you listen to folks that live all across Hampton Roads. What are some of those key issues that you're hearing from residents along your campaign trail that you're ready to tackle if you are the next congressional district leader?
Thank you. So the biggest thing that I'm hearing is that people just want people who actually fight for them and show up. We have candidates running in this primary who have taken the community for a run. They don't show up to debates. They don't show up to candidate forums. They might go to some meet and greets, and I don't think that's right. We have people who, you know, there's been a candidate forum in Virginia Beach, there's been one on the Eastern Shore, and there's been one in Suffolk. And only 3 out of the 4 primary candidates has shown up. People don't like that. They want somebody who can answer the tough questions. And on my campaign, I am here to answer questions from every single person. The main issues that I hear on the trail are really about affordability, healthcare, housing. We have plans for each one of those sections, but honestly, the biggest one that I hear, and I think it's because I'm a doctor that people tell me more about their healthcare issues. They're always like, is there a rash here? Or something like that. But what I'm hearing in healthcare is that, you know, the premiums are too high. People are going without insurance, just plain and simple. And it's really hurting a lot of people. And it's not just, you know, about your job or, you know, other things, sort of material things. It's their lives, right? It's whether you can actually get up and go to work. And that's what I'm hearing the most. The other thing that I'm hearing kind of after that is just housing affordability, right? We have to put regulations in place to control these private equity firms so that they stop being able to buy up so much land and housing stock and outprice the community. So those are kind of the biggest areas that I'm focusing on. But for our campaign, I am so confident that we will win this election. We have been fighting for the past year, essentially, but we've been making inroads into the community. We had a hill to climb, right? I'm a first-time candidate. We didn't have the name recognition that some of the other candidates have. But I will say, every place that I have gone in the last couple of weeks, even the last couple of months, more and more people are recognizing that they don't have to choose between the lesser of two evils in a general. And that's what I always say to people when they say, oh, here's the general election and I am choosing between the lesser of two evils. I always ask, did you vote in the primary? Because the primary is the chance that you have to choose a candidate that matches your values. You know, whatever you think about, you know, how much money somebody's raised, what it really comes down to is who is going to represent you the best. What is your belief system? Does your belief system match theirs? And I encourage everybody to go on my website, check out our policy positions, come to an event, come talk to me, because I am here and I am accessible. If you talk to anybody on my staff, which by the way, my staff is almost 100% volunteer, they are extremely passionate. I mean, I'm telling you, I just want to give a shout out to my team, you know, particularly my campaign manager, Marianne Dottie. They are incredible and not getting paid to do this, but incredibly passionate about what we stand for and what we need to do to get the right people in Congress. One of the things that I wanted to highlight was the fact that there's been pretty low voter turnout during this primary election, and I think that's for a number of reasons. First, it's a primary election, right? Not a lot of people vote in the primary. They absolutely should, because as I said before, it is the time where you get to choose a candidate that matches your values, and that's critical because otherwise we have pretty low voter turnout when it comes to the general. If you're not excited about the candidate, if they don't represent you or your ideas or your generation or the fact that you're a working person or whatever it is, then maybe you're not really inclined to vote for them or you don't agree with their policies, right? So we need to get more people aware that there is a primary going on. And I think the second part of that is that most primaries are in June, but we have a really historic election. Ours got moved to August. Why did it get moved to August? Because of the referendum. And I know there's been a lot of voter fatigue with that. People really went out and voted, you know, in large numbers. And even though it was vote yes, that vote got overturned. So I can understand why people feel discouraged, but I want to tell everyone at home, your voice matters, your vote matters. Don't let these systems or even the feelings suppress what you have to say, right? We have to keep fighting. I know it's hard, I know it's tough, but if you let the voter fatigue get to you, they win, okay? And we cannot let that happen. We have to make sure that the community is here and that we are making our voice heard.